Our last speaker of today is Sameena. She is Director of External Affairs at EIT Health, and she will be talking about a recent report EIT Health wrote together with McKinsey about the role of artificial intelligence in healthcare. Sameena, the floor is yours.
Thank you. Do you have my slides?
Can you see them?
I can, thank you. Thanks very much. Firstly, thank you to the Sapphire Consortium for inviting me today to share with you the outputs of some recent research looking at the topic of AI in healthcare. But just to let you know, I won't be looking at how AI can be applied in personalising healthcare, but rather some of the environmental enablers and impediments to its use. To start though, I'll tell you a little bit about EIT Health for those in the audience who are not familiar. We're a knowledge and innovation community, which put simply is a public-private partnership under the umbrella of the EIT, the European Institute of Innovation and Technology, an independent body of the EU. So we partner with approximately 150 organisations spanning the entire spectrum of healthcare, including, amongst many others, industry, academia, research organisations, healthcare providers and payers. And we have 7 regional innovation hubs that are situated in areas that represent not only the geographic distribution of our partners, but also thriving regional innovation ecosystems. And EIT Health InnoStars, a member of the Sapphire Consortium, is one such innovation hub. And it's in collaboration with our partners that we aim to tackle some of Europe's biggest healthcare challenges. And we do this through the provision of relevant education. We create, scale up and scale out new healthcare businesses, and we bring innovative products and services to market. So alongside this, EIT Health also has a think tank, which is a forum through which we explore and assess the most pressing topics shaping healthcare and impacting the uptake and adoption of innovation. And in brief, we conduct research, we gather insights from subject matter experts, and we share this knowledge and evidence with relevant actors and decision makers. And it's through this platform of the think tank that we've taken a deeper exploration into what is holding Europe back from widespread uptake and adoption of AI in healthcare. And next slide, please. So some background first. So last year in March 2020, we launched a joint report developed by EIT Health with McKinsey and Company entitled Transforming Healthcare with AI, the Impact on the Workforce and Organisations. And the intention here was to build upon existing literature and perspectives on the applications of AI, the benefits of its use, many of which are already well known and understood to us, such as supporting care outcomes, driving productivity and efficiency, and ultimately to provide better and more personalised care. But this specific research went a step further in helping to define the impact of AI on healthcare practitioners and the implications of introducing and scaling AI for healthcare organisations and healthcare systems across Europe. The findings generated through in-depth surveys and interviews could be broadly categorised into these 6 domains as outlined on the slide, and all coming together essentially to describe what healthcare organisations will need to do and what healthcare systems will also need to do in order to embrace, embed and utilise AI to its full potential. As a supplement to this report and through the work of the think tank, we wanted to explore how the recommendations made could be translated at the national and systemic level. Were the right barriers and enablers identified? What was feasible and applicable, and how could on-the-ground impact be achieved, and who needed to be involved to implement that change? So with those questions in mind, we undertook roundtable meetings in each of our 7 regional innovation hubs, each attended by national multidisciplinary experts reflecting these 6 domains. So those specialising in medical and clinical education, healthcare practitioners, regulatory and policy experts, AI developers, and others who are involved in developing and implementing AI approaches at scale. And interestingly, the meetings took place during the late spring, summer period last year, and naturally the pandemic brought many of the issues discussed into sharper and more urgent focus. And it's also through the last 10 months, 12 months that we've witnessed the increased adoption of digital tools, both in care delivery, such as remote monitoring, and also in information provision. And as such, I think it's probably fair to say that there is now a wider willingness to engage meaningfully in a dialogue over the benefits of scaling digital health and AI solutions in healthcare. And we've also seen increased investment in digital healthcare and a renewed focus by the EU institutions on strengthening public health systems and digital and analytics capabilities. Next slide, please. So to key takeaways then, and this is really a consolidated and abbreviated view based on the main commonalities across all of the 7 meetings. Looking at actions identified at the member state level, there is a clear need for greater collaboration, exchange of best practices and lessons learned. The need is critical at pan-EU, national and regional level, and is necessary between multidisciplinary stakeholders, between developers and practitioners, for example. Creating such groups will facilitate the identification of use cases through to design, testing, implementation and scaling up. And following on from this is the need to leverage and build upon existing infrastructure. There was much mention of the digital innovation hubs. Although these are not necessarily sector specific, they can provide access to technical expertise and experimentation. The need to rethink education and skills and to drive investment in new roles and talent is a crucial component to ensure the required competencies. We need to reshape training for healthcare professionals, identifying new role profiles, looking at reskilling, upskilling, and looking at general and specialist skill gaps. Attention should also be given to how such categories of professionals with hybrid clinical plus data profiles or entirely new profiles such as data scientists would be welcomed and integrated. And digital and data literacy, of course, is not only relevant to healthcare professionals, but also for citizens who need to understand and embrace new methods of healthcare delivery. Experts in the ethics and legalities of data use, intellectual property questions, when working with third parties, and best practices on data privacy and data governance will also become increasingly important. And finally, at member state level, revised reimbursement models will also need to be considered. How can cost effectiveness assessments be redesigned and new value-based financial models be introduced? Looking now to EU level actions, the focus on data is not surprising, as European Commission is currently developing the legislative framework for the European health data space. And as such, many of the longer standing issues around data quality, access, interoperability and usability, etc. being prioritised. But having said that, there's an urgent need to establish the right IT infrastructure, providing guidance on data management and governance and defining common standards and appropriately incentivise adherence to those standards. Guidance is also lacking in relation to the regulatory picture. It's rather ambiguous, and this has been expressed on numerous times. The recent draft proposal for a regulatory framework on AI, whilst useful to drive higher levels of trust and confidence and the setting of minimum standards, won't necessarily accommodate the nuances inherent in healthcare, so a sector-specific approach would indeed be helpful. Agile regulatory processes are needed that are sufficiently flexible and adaptive to the rapidly changing technological landscape, and a shared approach to governance, regulation and risk for healthcare data would also be valuable. I'll finish by saying that we recognise, of course, that AI is still very much being evaluated, but healthcare investment is increasing, and we should be thinking about the role that healthcare systems, public and private players and individual healthcare practitioners can or should play in ensuring citizens fully reap the benefits of AI in terms of clinical care quality, outcomes and access. So that was a whistle-stop tour of two key pieces of research, and both reports are available and really worth reading. Some very useful insights from them. Thank you.
So thanks a lot. Your key takeaway messages are actions on the member state levels on the one hand, and on the other hand on the European level. But I suppose some of the actions needed on member state level are also needed on the regional level, especially in innovation, inter-regional cooperation, collaboration, and so on.
Absolutely. And interestingly, I personally think many of the member state level challenges remain applicable in the context of regions, but I think a particular challenge here is that you are likely to see another tier of fragmentation with differing systems, funding models, incentive frameworks, outcome measures, and these lead to differing capabilities and vulnerabilities. The extent of readiness of public healthcare systems, I think this is particularly challenging. The integration of AI into existing care pathways is problematic, and ongoing assessments of how AI can be integrated into the workflows of clinical staff as well as patients need to be made. And I think a way to address this would be for regions to cooperate in defining an appropriate regional AI strategy, and that such a strategy must be jointly owned and led with concrete plans and investments in helping scale AI. Providing incentives and guidance for teaching hospitals to collaborate as clusters, forming centres of excellence at the regional level, I think would be really instrumental in facilitating a wider spread adoption around trustworthy AI, and where there is increased agility for rapid experimentation and testing. Acting as sandboxes is critical, and this can be achieved at the regional level much easier, I think, at the member state level in many cases. And such centres can seek to leverage joint strengths and investments. I think something that was particularly key also was this need to bring together multidisciplinary teams, this sort of cross-fertilisation of AI developers, startups and SMEs with clinical staff, and importantly, including patients and citizens, and understanding those existing workflows, not only from a sort of clinical perspective, but really co-creating solutions that have a human AI collaboration in mind. The lack of multidisciplinary development and early involvement of healthcare staff and limited iteration by joint AI and healthcare teams have been cited as major barriers to addressing quality issues early on and adopting solutions at scale. And this type of cross-fertilization also supports the building of clinical evidence of quality and effectiveness of AI solutions, the ease of use and the quality and performance of algorithms, and of course the robustness and completeness of the underlying data, which I think is particularly relevant not only for patients and citizens, but also healthcare professionals. And I think that also helps speak to the challenges of ensuring that practitioners and patients also have resources and expertise required to evaluate safety and efficacy. Just another point on the concerted effort that's required between tech vendors, startups, academic centres, hospitals and healthcare organisations. I think what this allows the teams to do is whilst including patients, is to build a more holistic view, enabling a connection of the dots across various medical conditions and that patients may have, and along the continuum of care. And vehicles should be created for continuous patient engagement and feedback without, of course, contravening privacy laws. And I think this is also a place for the regions of having specific regional level legislation, which may help secure appropriate data exchange and access to properly annotated data for research and clinical practice while safeguarding patient privacy. And I think the ability, sorry, were you asking another question? Sorry.
No, it's okay. I'm listening to you.
And I think all of these pieces come together to be able to identify a number of use cases that can easily be applied with the right leadership at the hospital, primary, secondary, tertiary care level, and with organisations that demonstrate the delivery of value and develop a systemic approach to making these use cases embedded in day-to-day delivery of care. Just finally, I think regions can also facilitate, and this is really quite crucial, the sharing of knowledge and data to promote continued collaborative research, grassroots cooperation efforts, and promote the transfer of expertise. As mentioned previously, the digital innovation hubs could support ambitious trans-regional projects and could be extended to support the development of health data spaces and sandboxes for testing and verification of AI applications. EU has noted that funding will be made available for hubs that are already or will be supported by the member states or regions. So I think this is something that's really absolutely worth exploring at the regional level. And then lastly, just to mention, it's worth mentioning the fact that there is still a huge shortfall of physicians, nurses, and other allied healthcare professionals globally. And this has certainly been accentuated by COVID and is also particularly relevant in rural regions. And I think this is particularly important now when we're looking at resource-strained hospitals. And these clusters, this transfer of knowledge and expertise should aim to redesign workforce planning and clinical education processes, tailoring talent and educational programs delivered by a diverse set of education providers and through diverse channels.
No, thanks. So, and we have a question from Jan. What's the role of EIT Health in promoting regional complementarities or collaboration across EU between the different hubs?
Yeah, just very briefly, I can mention a couple of things, but I think it's also worth highlighting the sort of very specific, unique position that EIT Health holds, which is having access through its network to real-world experience and evidence, and can use this as a sort of testing facility and to generate the right kind of insights that really help inform policy decision making, or helping inform the sort of the generation of evidence to support acceptance and an adoption of such technology. A couple of examples of what we've done in the past and something that we're actually working on now. So when the guidelines came out in 2019 around AI and ethics, we undertook some specific research with our innovators and our startups in the community and other stakeholders to provide early indicators of how the health innovation community were considering ethical applications when developing products with an AI component. And really interestingly, at that time, only 22% of participants were aware of the guidelines, highlighting a large void of appropriate information reaching innovators. And I think this has been expressed about a lack of clarity or guidance, where there are areas of ambiguity that lead to sort of risk aversion and lack of confidence, and not necessarily knowing which data is being applied to evolve which algorithm, sort of this black box mentality. I think this kind of information where innovators are supporting other innovators, I think, is really key. And we are currently working with DG Sonte and DG Connect on actually engaging with our network at the moment in looking at specific data challenges to support the Commission on the development of the legislative framework for the European health data space. So what we're doing with members of our network is we're looking at specific use cases that illustrate real world use of data, and looking at real world challenges and impediments, and really identifying what good would look like in such a sort of cross-border data sharing platform that the Commission is aiming to develop across care provision, care planning, or research. And I think this is a really useful exercise because it allows us to unpick the challenges that innovators are encountering and understanding what really needs to be considered alongside the other kinds of research that the Commission undertakes. I think this piece, to be able to develop real-world evidence, real-world insights, and real-life experiences, I think is a really sort of unique perspective that EIT Health and its network can provide. Just to speak to our educational programs, I think this is a very sort of clear area where EIT Health also has a sort of a tangible and palpable contribution to make. So working with our partners, we're looking specifically at how to train and upskill healthcare professionals, and this falls in line with the Commission's current Pact for Skills agenda, and sort of the aspects that we're currently looking at around the sort of transformation of healthcare and the role of digitalization and AI is to focus not only on just raising awareness of healthcare professionals around the relevance of AI and how it can support clinical practice, but also on specific digital techniques that improve areas of healthcare like diagnosis, and how to sort of facilitate the patient and healthcare professional interface around shared decision making and improved patient relationships, as well as all the more sort of technical focused education provision, like looking at data, big data, analyzing data, interpreting data, etc. So I think EIT Health has a clear contribution to make, and I think as the advancements and AI is changing and moving, I think we are able to sort of demonstrate a level of agility and dynamism within the network, and we continue to engage with relevant decision makers in that respect.
Mm-hmm. Yeah, that's the difficulty, as there are so many levels and competences and things that are needed to be all in the same way to have it work. It's really a challenge indeed. So
it is, but really exciting, and I think the last 12 months has really demonstrated, and in a positive way, if many positive things can be taken from the last 12 months, is that the digitalization of healthcare really is demonstrating value in cost-constrained healthcare systems. This is the way of the land now, and I think all relevant actors need to think about cooperating, defining joint actions to really expedite and accelerate the full integration of AI into existing healthcare systems. And I think the integration piece into existing healthcare systems is probably the sort of most challenging aspect of this.
Yep. So thanks a lot. So I